Secours Cancer Institute presents Cancer Answers.
June is Cancer Survivor Month, and joining me today are Mary Baker with Secours, cancer survivor Judy, and her sister Janice. Thanks so much for being here, ladies. Mary, who is a cancer survivor?
A person is a cancer survivor from the moment of diagnosis until the end of their life. And it's important that we honor and commemorate those who have been through cancer and are our survivors, because they are still dealing with issues, they still have needs, and we want to help them meet their highest quality of life possible.
And why is there emphasis now on this phase of care?
Because thankfully treatments are improving with time, and we have many more people living to the end of their cancer treatments. Currently we have roughly 14 million cancer survivors in the U.S. That number is expected to grow to 18 million by 2022. And that is the good side of our cancer care. The side that is more challenging is that many of these people are experiencing late and long-term effects after their treatments have ended. And our cancer community is beginning to realize we need to pay attention to this and find ways to help these people.
What are some of the challenges faced by cancer survivors?
Some people deal with issues with memory and concentration after their cancer treatments. Others struggle with lymphedema, which is a swelling of an arm or a leg if lymph nodes have been removed. Other people have issues with peripheral neuropathy, which can cause some dysfunction due to numbness of their fingertips or their toes. But not everyone at the end of cancer treatment has these issues, and many times if they're not experienced during the course of treatment, they're not going to come years later.
What types of healthcare providers are involved in this type of care?
In a perfect world, it would be a multidisciplinary approach where you not only would have physicians, nurse practitioners, physician's assistants, nurse navigators, and social workers, but also rehab specialists, counselors, nutritionists dedicated to oncology care, and psychologists, and also chaplains.
What is your role in cancer survivorship care, and how can patients access your services?
So I work as a nurse practitioner, and part of my responsibilities are to maintain a survivorship clinic where patients can schedule visits at the end of their initial treatment, either referred by a member of their cancer care team, or they can self-refer. And during that visit, we have a chance to go over everything they've been through, find out what issues are still going on for them, give them a sense of what types of symptoms to report, as well as what late effects may be a part of their cancer experience and what to watch out for years down the road. In addition to that, though, it's a more global program where I bring programming in for our cancer survivors, as well as keep abreast of all of the programming and services in our area that they would be able to tap into. They can access my services by calling and making an appointment at one of our offices. I have clinic locations at all of the 4 Richmond Bon Secours hospitals.
When should a cancer survivor become involved in this type of program?
Initially, at the end of their cancer treatment, within that first couple of months, to me would be the ideal time, and this has been confirmed by different survivors as well, because that's the time when they are being released from their cancer team to go to a 3 to 6 month schedule for continuing visits, and they are many times feeling lost after having that close connection with their treatment team. They're also ready to hear what are the ways they can improve their health and what should their piece of surveillance be. So it's that teachable moment during that time. Unfortunately, when patients are not aware that the service is available, they may flounder on their own for the next 6 months trying to put together what their surveillance should be like, what they should watch out for, what activities could help reduce their risk.
What are some local resources for cancer survivors?
So one that I would like every cancer patient and survivor to know about is the Legal Information Network for Cancer, which works with our patients and survivors to help in various ways. If they financially qualify for the service, they're able to access attorneys for free to help them with family estate planning and advocacy for jobs and health insurance and things like that. In addition, we have a wide array of support groups for all of our cancer survivors throughout our city and our different health systems. And one aspect that I'm very proud of and very proud to be a part of is a Survivorship Journey Cancer Survivor Conference that we offer free to our community every fall, and it's available to our cancer survivors and to their caregivers to come for the day. And in early June, we'll have at each of our 4 Richmond hospitals a cancer survivor celebration, honoring our cancer survivors and their families. And we hope many will come for this joyful free event.
What is a survivorship care plan and how does it help cancer survivors?
A survivorship care plan is a 2-part document. The first part summarizes the cancer patient's care they receive, surgery, radiation, chemotherapy, whatever combination. And the second part will lay out for them what their follow-up plan is that their treatment team has recommended, what surveillance testing they may need in the future, and who will provide that and who will order it, and what their plan should be for taking care of themselves, health promotion, other health screenings, and symptoms to report to their team.
What is the emotional impact of cancer?
It can be huge. What I witness frequently among patients is that their families are there with them 100% during treatment, but the families get tired too. And so they are really feeling like at the end of that treatment, life can get back to normal. But for many of these survivors, they're still dealing with the emotional impact of, will I be able to go back to the same job that I had before? Is this fatigue ever going to get better? What happened to my memory? I can't multitask like I used to be able to. And then there's the fear of recurrence that many of them experience as well.
What are your hopes for the future of cancer survivorship?
First of all, an end to cancer, but even if it ended today, there would still be plenty of survivors who would need support and care and resources. So I would like to see more effort made towards survivorship research to help us find greater evidence-based cures and treatments for those lingering symptoms that patients have. I would like to see cancer rehabilitation to be an integral part of all cancer programs, and to also provide patients throughout the continuum of their care with oncology-focused nutrition services, and to have survivorship clinics run by advanced practice professionals at every center as well.
And now let's talk to Judy, a cancer survivor. When did you start seeing yourself as a cancer survivor?
In August of 2013, I was diagnosed with breast cancer. And of course it was a shock. I never expected that. So from then on, I just went on with whatever was coming next.
Tell me about your cancer journey.
Well, after I was discovered with the breast cancer, I had many visits with many doctors from St. Mary's Hospital, which I am eternally grateful for because they've been the best in the world. And I went through the surgery, and I went through some blood clots, and I went through chemo, and I went through 33 rounds of radiation. And I just went through it like it was nothing. I just couldn't focus on the fact that it was cancer. And I was amazed at how well I did through the whole thing. I had good company with me, so that got me through a lot of it. But it was an experience, and one I hope that I won't have to face again, but you don't know what the future brings.
What was the end of treatment experience like for you?
It was a relief to know that I had accomplished all that, and I don't know what it felt like other than relieved. I didn't have many problems from all the treatments at all. I did have, the only thing I can think of is I did lose my appetite, and I lost a lot of weight.
In what ways has your cancer journey changed the way you take care of yourself?
Well, through that experience, and after losing my appetite, it brought to mind that I need to get my appetite back and to eat healthier and get control of my body again. Instead of letting things take care of me, I'm going to take care of them.
Has your cancer journey changed your priorities?
I can't say that it really has. I mean, I'm doing things the way I always did. I know there's things I need to do better, and I'm going to try to work at that, like eating better, getting myself under control, and getting my brain to function a little better. But other than that, basically it's the same.
What have been the most meaningful parts of your experience as a cancer survivor?
Well, the one thing it did do was bring my family closer together. The fact that my sister was taking good care of me, and my two nieces who both had breast cancer and survived, and they were there for me. And my neighbor lady across the hall was checking on me every hour on the hour. It was very comforting to have all these people around me helping me if I needed help.
Did you receive a survivorship care plan, and if so, how has it been useful to you?
I did get one, and to this day, I still research it every day to see if there's better things I should be doing. And I keep in touch with my doctors, all my wonderful doctors. I see them the oncologist I see every 6 months, the radiologist I see every 6 months, so every 3 months I'm going to one or the other. But I love them dearly, and they are the best people in the world.
What advice would you give a fellow cancer survivor?
Keep a calendar of all your appointments, all your procedures, the dates you had something done, what you had done, because to this day, I still go back and see where I was a year ago as to where I am now, and the big improvement that I have come through.
And how are you doing now?
I'm doing fine. I have no limitations to what I can do. In fact, sometimes I think I overdo everything, but I feel great.
And now let's talk to your sister Janice. What has been the most challenging aspect of your sister's cancer diagnosis?
I think just the fact that she was diagnosed with cancer, we always expected that it would be me, because my mother had breast cancer, her sister had breast cancer, they both died of it. My two daughters are cancer survivors of breast cancer, so we thought it would be me next. Here it was Judy, so that was a big shock.
How did this affect your relationship?
It brought Judy and me closer together. It brought me closer with both of my daughters. We came together as a unit, and we went through this as a unit. And I would advise any families who are experiencing cancer, if they can do that, it makes it so much easier, because it's a very difficult road to go. We're closer now than we ever were. We always were close, but now we're even closer.
And how did it change your life?
Well, I put off a lot of things that I should have taken care of, but Judy came first, and we got through it. My daughters helped.
What additional resources should be available for caregivers?
I can't think of anything, because Secours just was there for us all the time. I think if you have a faith, your minister, your clergyman, your priest would be a great resource. Your family is always a great resource, but with Judy and me, Secours was the resource that we went to every time. I never had a question that Secours, that I couldn't go to Secours, St. Mary's, the doctors, the nurses, that they didn't answer. If I phoned them, they answered it immediately. If they weren't there, I got an immediately phone call back. So it was always good. I never had a problem, neither did Judy. And when we went to the doctors, when we saw Dr. Chin, Dr. Duffy, we always had our list of questions with us. And I would advise anybody that has cancer to do that. Take their list of questions with them.
Thanks, ladies. And for more information on cancer survivorship and cancer survivor days at Bon Secours, log on to goodhelpforlife.com.
Bon Secours, good help for a lifetime.